Hello people, in this video let us look at wound, right? So basically wound healing, factors affecting, classification of wound, that's what we will look at. Then what happens after wound heals, right? It can leave a scar. So that scar can be either keloid or hypertrophic scar. We'll look at that. So let's get started with this chapter. So basically what is wound, guys? Wound, it is a discontinuity or break in the epithelium, break in the surface epithelium. So if this is epithelium and there is a discontinuity or a break, that becomes a wound. Then what is necrosis? What is ulcer? So when there is necrosis underneath, this will be called as an ulcer, isn't it? So that is what is the definition of ulcer. So let's look at the classification of wounds, guys. So many ways are there of classifying wounds. Let us look at one simple one here. You have the simple wounds and the complex wounds. Simple is when only the skin and the subcutaneous part is affected. Complex is when, something underneath is also affected, like the nerves, the vessels, the tendons, muscles, all these, if it is involved, the wound is complex. So a simple one is just involving your skin and subcutaneous tissue, okay? Then there are other classifications. So let us look at this. You have closed wounds and then you have open wounds. Closed wounds are something like this. You have contusions, abrasions, hematoma. Do you feel they are open? No, they are not open. They are closed. And then you have open wounds like laceration, incision, then penetrating wound, crushed wounds, right? So basically then you have avulsions also, degloving injuries, right? So all these would be open wounds. There's yet another way of classifying wounds like tidy and untidy wounds. Basically we will say tidy means clean wounds and untidy means contaminated kind of thing where devitalized tissues are often there. So this is tidy and untidy. They can ask you another way of asking this will be surgical classification of wounds. Okay, we will look at this also. Hold on. So look at this, guys. You have the clean wounds, right? Clean, contaminated, and then finally you have a dirty. So definitely clean and dirty we can understand. Contaminated also we can understand. But there is something called as a clean contaminated, which is really strange, isn't it? So you have a clean, contaminated, dirty. Dirty is the one which there is pus, right? And what is clean? Clean means like you are choosing to go into something like a thyroidectomy you want to do. You want to do mastectomy. So basically this is clean, right? You are not entering any contaminated field. Now look at this one. This will be easy to understand. You have to repair a ruptured appendix or some spillage is there from the bowel. If you have to do this, then this is a contaminated place, okay, where there is ruptured appendix, right? And coming to dirty. Dirty means what? We told you pus is there, right? So you want to work on a gangrene, right? That will be a dirty wound. Look at the wound infection rate. It's around 2 here, less than 10, 20, 30 to 70% they have written for a dirty. So you should be very careful while operating on this gangrene, etc., right? So let's say you want to excise this neck swelling. So what is it? It is a clean wound, right? So basically you have to, if it is a dirty wound or if it is a contaminated wound, you will have to give antibiotic prophylaxis, right? Because you know what are the chances of infection, right? So what prophylaxis will you give? You will give IV antibiotics before the surgery, 1 hour before the surgery, or during induction you can give antibiotic prophylaxis. Always you should use clean hands for surgery, etc. You know that. Well, people, you thought that you have finished the classification of wounds. No, it's not so simple. See, initially we saw simple wounds, complex wounds. Then we saw closed wounds, open wounds. Then we saw clean wounds, contaminated wounds, or tidy and untidy wounds. Now there is one more type of classification of wounds, acute and chronic, right? Guys, look at this. Yes, you have to classify it as acute or chronic, right? Acute is stab wound, you got stabbed in, it's an acute wound or a blast injury. Chronic wound means you have these pressure sores, bed sores, right? Ulcers, pressure ulcers. From a long time you have been enduring this wound, so it becomes a chronic wound. So, so far we have looked at the classification of wounds. Now, next we will continue with the healing, okay? Healing of wound will continue the next video. That's all for now in this. We saw wound definition and we saw the classification. Bye-bye.